The exact cause of this cancer is not known, but factors like family history and exposure to radiation can increase your risk. Dr. Marco Ruiz explains multiple myeloma.
Myeloma is basically a cancer of plasma cells, and plasma cells are within the bone marrow. And this is caused by some abnormal growth of these plasma cells that, with time, it causes multiple myeloma.
So what does the term myeloma mean?
Myeloma means that it is related to the blood. Basically, it belongs to the term, all older terms related to bone marrow. That's what it's called, multiple myeloma.
Okay, so let's talk about bone marrow, because we often hear it when we talk about leukemia. So what is the importance of bone marrow?
The bone marrow, believe it or not, is one of the organs that sometimes we don't see as a very important organ, but indeed it is an extremely important organ. It allows us to basically survive. It allows us to get this kind of a feeling of well-being, and we know that because when there's some decrease in some of the cells, we may experience symptoms and such.
Okay. Now, with the plasma cells we mentioned before, what is their purpose?
The purpose of the plasma cells is contribute to the production of certain immunoglobulins and also to the production of other cells. And also they help other cells to help us with the immune system and also with other different pathways in the body.
Dr. Ruiz, if you can explain to us the difference between a healthy bone marrow and one with multiple myeloma. We have a graphic, and if you can walk us through what it is that we're looking at exactly here.
Sure, exactly. In the bone marrow, just remember the bone marrow is basically within the bones. And as we can see there is a compartment, or what we call an environment of bone marrow. So we got within the bone marrow, of course, we got the white cells, and then we got just kind of, if you see on the left side, we got the plasma cells. We all do have plasma cells within the bone marrow, but when there is an abnormal growth due to mutations or other certain specific alterations, it can cause a abnormal plasma cells that what it causes is an overgrowth of these plasma cells, and as such it takes over the bone marrow, and then the white cells, red cells and platelets are not produced in the same way that they used to.
And it seems, does it eat away?
Yes, that's correct. That's correct. And one of the manifestations of myeloma, of course, that it attacks the bones. So that's why sometimes the presentation of myeloma is when patients have some what we call lesions in the bones, and we're going to talk about that in a few minutes.
Thank you, doctor. Now, before we go over the symptoms, I just want to take a moment and remind our viewers to call in if you have a question. That number is 855-796-4475. We'd love to hear from you. Okay, so let's go over some of the symptoms of the disease, including that bone pain that we often hear about. So bone problems, that's a very common symptom of multiple myeloma, correct?
That's absolutely correct. And also besides the bone problems or the bone pain, we have low blood counts, especially when we have low hemoglobin, and sometimes we have some low platelets, high levels of calcium, of course, and sometimes that's the way patients present. Nerve damage, and that's sometimes the myeloma cells or the plasma cells go into the nerves and cause us some kind of trouble. And hyperviscosity means that because of the fact that we're dealing with abnormal cells, abnormal proteins are produced, and as such it causes, if you will, a thickening of the blood. That's what we call hyperviscosity syndrome.
So when we talk about that bone pain, I want to go back to that for a moment. Where are we talking about exactly? Where's that bone pain coming from?
The bone pain comes from the cortex, which is one of the external areas of the bone, and that is being affected by the plasma cells, and that causes the bone pain that patients manifest.
Can that bone pain be so severe that it can often cause fractures?
True, and that's one of another common presentation. Patients go to the emergency departments and they develop what we call a pathological fracture, meaning out of nowhere, patients get a fracture with no significant risk factors before.
So would you say that all these symptoms can happen at the same time? We talked about the bone pain, but there's also that fatigue, that tiredness that comes as well. Are we seeing that?
True. We're seeing that in conjunction with bone pain, and we can see all symptoms together. Sometimes patients may present to the emergency departments or primary care doctors with bone pain, high levels of calcium or confusion or altered mental status, and also with other manifestations such as low hemoglobin, low platelets, bleeding, and so forth.
I was asking you during the break, doctor, if some of these cancers can be genetic. In the case of multiple myeloma, is that something that can run in a family?
There is if you have someone in your family affected by multiple myeloma, your risk may be a bit higher compared to what we call the normal population, but doesn't necessarily mean that you're going to develop multiple myeloma later in life.
Okay. And does it also mean that if you're a man or you're an older man, that you are at higher risk?
And that is correct, because the frequencies, the epidemiology studies have shown that elderly patients usually are the ones affected by multiple myeloma.
And what if you have HIV? Does that put you at a higher risk?
That's such an interesting question. The studies have shown no significant correlation between HIV and multiple myeloma.
Right.
Indeed, the frequency is not increased by the presence of HIV infection, as opposed to lymphomas, in which the frequency is much more increased. But by multiple myeloma, there is no correlation between HIV infection and the presence of multiple myeloma.
Dr. Ruiz, can this cancer be caught at an early stage?
That's such an interesting statement. Multiple myeloma is what we call a non-curable disease, and there is what we call a pre-multiple myeloma stages. And the first one is called MGUS, M-G-U-S, which is basically the acronym for a monopathy of, it's a monoclonal gammopathy of a non-significance, meaning that there is some production of a normal proteins in your body. Depending upon the structure of that protein, the symptoms, or patients usually they don't have any symptoms, and they can go with this condition for years. Sometimes they can go up to 5-7 years, and they progress to what we call a second stage, which is called a smoldering multiple myeloma. And after smoldering multiple myeloma, these patients go into what we call an active multiple myeloma. The time frame is usually about 10 years from the development or the detection of that normal protein into what we call active multiple myeloma.
When you talk about it being a non-curable disease, I'm curious to know, is this then, can multiple myeloma be something that's chronic?
True, and this is what we call a chronic disease, simply by the virtue of the fact that we have better treatments that we used to have in the past, and nowadays is more, and the intent is to just kind of put it as more of a chronic illness as opposed to be an acute or something life-threatening illness at this point.
If you would like to hear more of the doctor's interview, download the Health Channel app.